Well, it is 1 o'clock. Welcome to our first mini conference for LGBTQIA+. Hi, my name is Dr. Michelle Chappelle. I'm the Diversity, Equity, and Inclusion Coordinator at the Henderson Community College. As you see on the screen now, this is the flyer that we have going on. We got some good speakers. I'm going to share the agenda in the chat. So this is our agenda today for our mini conference. We also will be having door prizes, so I will also put that into the chat as well as a form for you to fill out to be entered for door prizes. And also there will also be a survey for this event. So now I'm going to turn it over to Dr. Warren.
Good afternoon, everyone, and thanks for the opportunity to talk to you. I'm looking forward to this conference, and welcome Tina Reed and friends from Matthew 25. Friends right down the road, and I've enjoyed working with Cindy Burton and a number of people over there. Just some really good work that goes on. Excited that these kinds of events can be sponsored by our Office of Diversity, Equity, and Inclusion. Appreciate Dr. Chappelle and all the work that she's doing to help us to make sure folks know that we are an open and welcoming campus. Appreciate Adam Blair and his work with HCC Pride Club, and just how everybody's working together to let folks know how welcoming we are, and we grow and learn together. And it's these kind of conferences and meetings that helps us to really support our students. And student engagement, there's nothing more important in students being able to make a personal connection with somebody. Doesn't matter who it is, but somebody on our campus, through a club, through just advising, or somebody just showing a little bit of interest in them as they're meeting with them on the sidewalk. And so that's really important to our entire campus life. So again, that's why we do these things, and looking forward to what we learned today and being better participants within our community. So anything I can do to help any of the organizations represented, be sure to let me know. And I'll be quiet and let the show begin.
All right, thank you, Dr. Warren. Thank you for that nice welcome. Adam Blair.
Thank you, Dr. Warren. Thank you, Dr. Chappelle. Up next, I just wanted to let everyone know we have Miss Tina Reed. She is the Director of Prevention Services with Matthew 25. And as Dr. Warren mentioned, they are a very close neighbor of ours. They're right down the road. We've also worked with them as the Pride Club and the Office of Diversity, Equity, and Inclusion to help service our community. So Tina Reed is going to take over and give you some information, some statistics on both the services that are offered and how we can assist them in their mission.
Thank you, Adam. While Tina's getting prepared to put her slides up and show her screen, I just want to make everybody aware that this event is being recorded.
All right, can you hear me?
Yes, ma'am.
All right, just wanted to make sure of that. Thank you guys so much. Adam, we were super excited when you reached out to us, and we're always excited about the opportunity to speak in front of a group of people. And yes, you are, we could throw a rock and hit your building, and great partners in the community here in Henderson. So I want to start. My name's Tina Reed. I'm the Director of Prevention, and I've been with Matthew 25 for about 1.5 years, and I am a nurse. My background is mainly ortho neuro, some home health and long-term care. I came on board with Matthew 25. I'd heard about Matthew 25 and saw the opportunity. And I can tell you in the 30 years of nursing that working here has been the most rewarding job I've ever had as a nurse. So I would just wanted to emphasize that. And today I just really want to talk to you about Matthew 25 and what you should know about HIV. So I'll go ahead and get started here, and we'll, after the presentation, we'll open up for questions. So who is Matthew 25 and what do we do? We really started in 1996 as a volunteer organization at a church. There were a few volunteers that really wanted to help a few of the members of the congregation who were living with HIV. And then as they were doing that, realized there was a much bigger need in the community. So that really started in the church. And then on to 1999, we were granted a 501c3 status, which allowed us to seek funding to actually get paid staff. So those volunteers actually became employees of Matthew 25. And yes, Miss Cindy Burton is one of those original volunteers who started the organization, and she is actually retiring in March of 2022. Courtney Wolfork is going to be filling in her shoes, which are very big shoes to fill, but I'm confident that Courtney will do a great job. So we started with, just a few employees. Now we are up to about 54, most of which work in the Henderson location, but we have 4 locations now, and I'll show you all of those here in just a second. So we are comprised, we're basically like a doctor's office. We're a clinic. We have 3 nurse practitioners, 2 of which are HIV specialists, and 1 is a primary care specialist. So we're able to diagnose and treat people living with HIV. And that's our mission, is to support, educate, and treat those living with HIV and affected by HIV and AIDS. In our clinic, we have phlebotomists that are able to do blood draws in-house, so people don't have to go drive to a lab and then wait for results to come in. We have licensed mental health counselors and also nutritionists that are able to help with keeping that nutritional status up and keeping folks healthy. Among that, we've got support groups that we hold monthly, not only for our patients, but family members as well. Housing specialists, many of our patients are unfortunately homeless, and some, they may have a home, but have fallen on hard times and, maybe nearing eviction, or maybe their electricity getting cut off. So we are able to assist in those emergent type needs. The medication for HIV treatment is very expensive, so we're also, through funding, are able to offer pharmaceutical assistance and transportation, because so many of our patients don't have transportation. Like in our rural communities, some folks might even have to drive as far as 2 hours to get to one of our clinics. So, and then if you don't have transportation, that's a big barrier. So we are here to find out what the barriers are and try to meet those needs. So we have our own vehicles, we have our own drivers, and they're able to go pick patients up and get them to our clinics. If they have a medical appointment, say with a cardiologist, we are even able to pick the patient up and get them to other medical type appointments. So on the prevention team, which is what I do, is I lead a team of about 9 people. We have our prevention coordinator, youth outreach specialist, is the same person. A few health educators, we've got a linkage to care specialist, and PrEP navigators. So what we are doing, we are out in the community. We are out educating. Anybody that will listen to us, we want to tell them who we are and what we do, and how to prevent STIs, hepatitis C, HIV, and anything like that. And we also are able to provide free HIV testing in the community. So we're going into homeless shelters. We go to colleges, we go to drug treatment facilities, just anywhere that is maybe has some vulnerable population. So this is our Henderson Clinic, stone's throw away from the college. We're very proud of this. It's an old church. We have added on in the last couple of years because of our growth. This is a picture of our Owensboro Clinic. I just love the Owensboro Clinic. It's sharp. It's very nice. It's right off Highway 54 on Litchfield Road. Our Evansville location is downtown behind the old post office there on the 2nd floor. We work very closely with ARG, which is right down the hallway of the same building. And our newest location is our Bowling Green, Kentucky location. We occupy that entire building, and that's one of our vans that we use for transportation. With Bowling Green, we do not have a nurse practitioner there on site, but at all of our clinics, we have admin staff, we've got nurses, CMAs, phlebotomists. So with our Bowling Green office, what we do is telehealth. and our patients go to the Bowling Green office. They're able to utilize the lab. Our nurses do the blood work there and send that off. And our nurse practitioner may be in Owensboro or they may be in Henderson, but we're able to do this video chat and basically it's just like being in an exam room. And even as a nurse, I didn't realize how sophisticated this equipment was. So when we ordered it, I thought that our nurse, would take the blood pressure, listen to the heart and lungs, look in the ears, nose, and throat, and just relay that information to our nurse practitioner. But this is far more sophisticated than that. It has Bluetooth peripheral equipment that the nurse practitioner is actually able to connect and hear the heart and the lungs, and that equipment they can actually see in the ears and nose and throat. So it's very cool. And it's also very HIPAA secure. So this is our service area. We cover 11 counties in Indiana and 25 counties in Kentucky. And folks in these areas would travel to see us in one of our 4 clinics. We do serve just over 600 patients in this area. What is HIV? It stands for human immunodeficiency virus. The human body cannot get rid of HIV, and there's no effective HIV cure. So once you have HIV, you have it for life. The CDC does recommend testing people of ages 13 to 64 for HIV at least once a year as part of routine health care. Those who are at high risk should get tested as frequently as every 3 to 6 months. That would include maybe men who have sex with men, people who inject drugs, maybe someone who has multiple partners and don't always use a condom, and possibly even, definitely even sex workers. So it is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. If left untreated, HIV can lead to AIDS. So there are 5 transmission routes of HIV, and you can only get HIV by coming into direct contact with these body fluids. And that is blood, semen, rectal fluids, vaginal fluids, and breast milk. I do want to emphasize that you cannot transmit HIV by kissing, hugging, touching, or contract HIV from a mosquito bite, sharing utensils, or even a toilet seat. Those are just some of the things that people think. We had somebody, we were getting ready to test at a location, and they came in for a test, and they were really kind of freaked out because they, I guess, shared a cigarette with somebody and actually were very, very concerned that they were going to contract HIV by sharing that. But you cannot transmit HIV through saliva. So just wanted to share that information with you. There are 3 stages of HIV. I first want to go over the acute stage. This usually happens within the 2 to 4 week period after exposure. Many, but not all people will experience flu-like symptoms, and some have even said it's the worst flu ever. So they'll experience fatigue, sore throat, fever, swollen lymph nodes. So there's the 3 stages. That first acute stage is where they become very ill. That's when people are highly infectious. That can last anywhere from a couple of weeks to even several months. The second stage, which is the clinical latency or chronic stage, can last decades without any symptoms at all. However, the virus is still active and it is transmittable. The third stage is when a person's immune system is very badly damaged and can no longer fight off serious infections, and the illness ends up ending up with AIDS. Without treatment, you will die by the time you get to this stage. This is really when people notice some symptoms of maybe weight loss, night sweats, skin rash, white spots in the mouth, recurrent infections, which we call opportunistic infections, things like TB, pneumonia, even certain types of cancer in that last stage of HIV. So some risk factors, we talk a lot about risk reduction in the prevention department when we're out testing. Some main identifying risk factors for transmission, I mentioned earlier, condomless sex, injection drug use, mother to child, and even occupational exposure. Some risk reduction efforts would be using condoms. I'll talk more about the syringe exchange program here in just a little bit. Regular doctor visits, and when we have folks come in who are getting tested and maybe they are told they're positive, one of the many questions that we get when we are having to tell someone that they now are living with HIV is, can I have kids? Will I ever, it's not a death sentence anymore. And yes, people can live long, healthy lives and they can reproduce, male or female. The most important thing is regular doctor's visits, getting on treatment, and taking care of themselves. Then also diligent universal precautions, mainly in the healthcare field. So nowadays we have these fancy tests called an INSTI test. Many years ago, you would have to get your blood drawn. That would have to be sent off, and you'd get your results a few weeks later. It then progressed to a test where you could get your results in about 20 minutes, and those do still exist, and we still use those. But now we primarily use, and the most common test is the INSTI test, which is a simple finger stick, as you can see here, and you can get the results in less than 60 seconds. And this test, they're 99% accurate, and what it's doing is checking for antibodies. After exposure to HIV, it can take 3 to 12 weeks for an infected person's body to make enough antibodies for the screening test to detect the antibodies. This is called a window period. So an individual may test positive with the INSTI test in as little as 21 days after infection. However, it can take as long as 3 months to produce a positive result. So for an example, let's just use me for an example. Say I was at a party last month and I engaged in some risky behavior and I wasn't sure and I wanted to go get tested. I would really need to wait. So if that was a month ago, I would need to wait 2 months before I got an HIV test to really know if to get a reliable test. There are ways, there's blood draws you can do. You would have to go to your doctor's office. That will detect it a little sooner, but there are no tests that will tell you immediately if you've contracted HIV. If someone thinks they've been exposed to HIV within 72 hours, they should contact their healthcare provider and ask about PEP. And I will talk about that here in just a few minutes. But there is no cure for HIV, but there is treatment. It's called antiretroviral therapy, or ART. People with HIV should start taking medication as soon as possible. If taken as prescribed, this reduces the viral load in the body, and it keeps the immune system working and prevents illness. This is called viral suppression. HIV medicine can even take the viral load so low that an HIV test cannot detect it. So think about Magic Johnson. Magic Johnson, many years ago, was diagnosed. He is taking care of himself. He's taken his medication, and he is at an undetectable viral load. So that is actually called treatment as prevention or task. So even if someone is living with HIV, there's prevention for that, for transmitting that virus. And that's what we focus on in our clinic is getting people to that undetectable viral load. So I've got some homework for you, whether you're a student or faculty member or just someone in the community hopping on. I want you to grab a pen and paper and I want you to write down U equals U. It stands for undetectable equals untransmittable. So in the second row here over on the left, that's Bruce Richmond. He is the founder, they're over here in the black suit coat. He's the founder of the Prevention Access Campaign, which formed the U equals U movement. And he was diagnosed with HIV back in 2003 and was told by his doctors that he was undetectable. So in doing research and just understanding how little people knew about undetectable viral load, he wanted to find a way to get the correct information out about a health condition often misunderstood and stigmatized in the public. So he left his full-time job in 2015 and started pursuing the help of leading HIV researchers. And in July of 2016, they launched this statement, and the CDC recognizes this statement of U equals U. So if we are able to get people on treatment, get their viral load so low that it's undetectable, they cannot transmit the HIV virus. And I just want to kind of give kudos to Matthew 25. The national average for viral suppression rate is about 88%. Back in 2010, it was at 70%. But currently, our viral load suppression, we usually hover around 92 to 93%, which is incredible. We do a fantastic job of keeping our patients in care and keeping them, we do our best to try to keep them healthy and engaged in care and keep their viral suppression rate, keep our rate super high. And actually the Evansville location has a 95% viral suppression rate, which is fantastic. So kudos to our efforts. You may have seen the commercials on TV, Prep Up, Step Up. The PrEP is a medication that people at risk for HIV can take to prevent getting HIV from sex or injection drug use. When taken as prescribed, PrEP is highly effective for preventing HIV. Many insurances cover PrEP, and we do offer PrEP at Matthew 25. What we do, if you have insurance, we do check benefits to see what is covered and make sure there's no out-of-pocket expenses for PrEP. In Indiana, there is funding for PrEP. So if someone does not have insurance, you could potentially still get PrEP, even if you don't have insurance. So some indications for PrEP, say someone's partner lives with HIV, the partner's HIV status is not known, if you've had an STI in the past 6 months, multiple sex partners and do not always use a condom, if someone has sex for money would be appropriate for PrEP, or uses injection drugs, or if your partner uses injection drugs. Those are all indications for PrEP. As I mentioned earlier, PrEP is pre-exposure prophylaxis. So now you have PEP, which is post-exposure prophylaxis. So this means, like I mentioned earlier, if someone had a potential exposure within 72 hours, an example would be in sexual assault. We do not prescribe PEP, but we get inquiries about it. What we do is refer folks to the nearest emergency room. They are able to prescribe PEP. What this is, it is a daily medication, and if it has to be started within 72 hours of a potential exposure, but people take it for 28 days to prevent that from the HIV virus from duplicating is what it actually does. So just to share some statistics with you, according to the CDC, approximately 1.2 million people in the United States age 13 and older are living with HIV. An estimated 36,000 new HIV infections occurred in the United States in 2018, and actually 1 in 7 people are living with HIV and are unaware of their infection. Most of those are in that second stage because you don't have any symptoms. So you may feel like you just had the really bad flu, and then your symptoms go away, and then you end up in that second stage and you're unaware that you are living with HIV. That's why it's so important to get tested. HIV diagnoses are not evenly distributed across the United States. The highest rates of new diagnosis actually continue to occur in the South. So the CDC data indicated that the progress has stalled in recent years. So as far as the number of new diagnoses, the goal is to reduce the number of new diagnoses, and that stalled around 2014, 2015. So in 2019, the Department of Health and Human Services launched Ending the HIV Epidemic initiative. This initiative aims to reduce the new HIV infections in the United States 75% by 2025 and 90% by 2030. HIV does not look the same now as it did in the 80s. The decline in HIV infections has plateaued because effective HIV prevention and treatments are not adequately reaching those who could most benefit from them. These gaps remain particularly troublesome in rural areas and in the South. And you'll see the 4 pillars here: the diagnose, treat, prevent, and respond. That's the big focus of this initiative, is getting people tested, getting them in treatment. We're talking about PrEP and syringe exchange services. And if we identify an outbreak, we have to respond quickly to prevent that from spreading even further. So this is obviously a map of the United States. And like I said just a second ago, most of the infections are highly concentrated in certain geographical hotspots in the South. Phase 1 of the Ending the HIV Epidemic initiative focuses on 48 counties. Washington, D.C. and San Juan and Puerto Rico together account for more than 50% of the United States HIV diagnosis, along with the 7 states that are in blue here. All of these have substantial rural burden of HIV. Is the big problem here. So I want to focus on the state of Kentucky now. The CDC has deemed 220 counties at risk of an HIV outbreak. So here you see the larger map with the green dots, 220 U.S. counties at risk. And if you look at the state of Kentucky, 54 of those counties, 54 of the 220 counties are in Kentucky. Grab that pen and paper again. I don't have enough time to go into the HIV outbreak that occurred in Scott County, Indiana. But if you will write down Scott County, Indiana, or Austin, Indiana HIV outbreak that happened in 2014, 2015, it was the worst drug-fueled HIV outbreak ever to hit rural America. So the first HIV case in Scott County attributed to this outbreak, and it went from 1 to ended up being 235 in one county, where this was a county that previously reported only 3 HIV cases in decades. Kentucky leads the nation in vulnerable counties, with most clustered in the Appalachian area, marred by drugs, doctor shortages, economic ruin, and hopelessness. One drug needle shared by someone with HIV could easily be the match to this outbreak. So this picture, I share this a lot because to me, this is staggering. I had no idea until I started doing a lot of research and got involved with, working for Matthew 25 and just really looking at this. And I share that. I share this because HIV is still a thing. A lot of people think that it's going away, but it's not. It is still an epidemic. So let's talk about prevention. Condoms, when used consistently and correctly, can lower the chance of HIV being passed from one person to another. There's the traditional male condom at the top. We also have the female or internal condom, which is the one there in the middle, and also dental dams. It just depends on your sexual orientation and what you prefer to use. The primary prevention is easy as ABC. A stands for abstinence. That's pretty much a guarantee of no transmission of STIs, HIV, or Hep C. B is for be faithful. Have an open, honest conversation with your partner. Go be tested together for STIs and HIV. It's the power of knowing your status. And then C, use condoms consistently and correctly every time. How can you help? So language is actually a big deal. So be intentional and thoughtful when choosing your words. Choose supportive rather than stigmatizing language when talking about HIV. So some examples, these are just a few. So you're not going to catch HIV like you're going fishing or something. The preferred way to say that would be diagnosed with HIV. Another problematic words would be HIV victim or someone who suffers from HIV. The preferred language would be they're a person living with HIV. Again, drug addict. Preferred language would be person who inject drugs. So this is putting, if you'll notice on the right, the preferred language is putting the person before the diagnosis. There are many, many more examples. If you're on your phone, you want to Google some things, Google U=U, Scott County, and preferred language for HIV. And couple more things. We do have volunteer opportunities. I'm actually going to get with Adam. We have a condom distribution program, and we offer safer sex kits, which includes 2 condoms and a lube, and it comes in a small package. It has information about ourselves, about Matthew 25, about our free testing, signs and symptoms of HIV, how it's transmitted, all in this little small package. So I'm going to get a box together for Adam, and I think you had mentioned that you guys were going to be able to help us out and get some of those made so we can get those distributed. And also, one thing I want to mention is Dining Out for Life is next week. I encourage you to go like us on Facebook, Instagram, or Twitter, and you will see information about Dining Out for Life on there. And we've got some really nice items. We've got jewelry for sports fans. We've got otter tickets. We've got all kinds of things, really cool stuff that people can bid on. So I will go ahead and open it up for questions if anybody has any questions.
Thank you, Ms. Reed. I am going to put another door prize alert in the chat. Please fill that out. I'm hoping that everybody can do that. Anybody have any questions? Adam, do you want to lead the questions?
Sure, I would love to go for it. I actually had several questions written down, Tina, and then you covered all the answers before I even got a chance to. Good. So one of the things I really wanted to ask you about was the undetectable, untransmissible. So I appreciate that you gave us the information on that. The other was obviously about PrEP, and you went over all that information. So one of the questions I had actually just concerns you guys at Matthew 25. I know you mentioned you're a 501(c), so you're or 501(c)(3), however that works, yep. But you are a nonprofit. So what are the traditional avenues that you go through to get funds for all the services that you offer our community?
First, we're a doctor's office. So if any of our patients come in, we bill their insurance just like a doctor's office would. So that's part of our funding. Ryan White funding, we get fundings through HRSA. So just for different kind of fundings through state.
A lot of grant and federal programs that you have access to. A lot of grant and federal programs, yeah. Sure. Okay. And then just in the amount of time that you've been there, I know that you mentioned that nationally trends have gone down. Have trends gone down in our area locally since you've been here with Matthew 25?
You know, I looked.
Infection rates and spreading rates and things like that.
Well, data is old. It takes a while for that to be, to kind of come back around. So what the data I was looking at was around 1819. So there were in Kentucky, I think about 7,000 cases. And in our area, in the Green River area, there were about 370 cases. I haven't looked at trends, but I will tell you, Adam, I think the pandemic has affected us.
Sure.
2020 was very difficult for the prevention team because everything was shut down. We couldn't go to the women's shelter. We couldn't go to the warm center or any place like that just to provide testing and counseling. So it was concerning. What we did, we had to come up with innovative ways to provide testing. So we did open up drive-through testing at most of our locations. So folks, if they wanted a test, they would drive up because we were not allowing people to come in to be tested. We had an increase of new HIV intakes.
Sure.
So it'll be interesting to see what that data shows. But I do know the pandemic has affected us.
Right. One last question. I know I've got some hands raised, so I'll pass it off to somebody else. I am originally from one of those southeastern Kentucky counties that you mentioned that's in those areas. And so I have a lot of family and things there. And so obviously the reasoning behind it is very spot on. But with your work with Matthew 25, are you aware of services that are similar to yours that are available to the Eastern Kentucky residents? Are there nonprofits like yours in other parts of the state?
There is, and I actually get on a Zoom phone call. That used to be in person. We would go to Lexington and meet, but there are programs specifically geared in the Eastern Kentucky area, Appalachian area, and it's called Finding Positives. And there's a more focused effort there
Sure.
than here in the western part of the state, because there should be.
Right.
But yes, there are organizations like Matthew 25 there.
Great. That's always good to hear. Okay, well, I will stop talking for a second and I'm going to hand it over. It looks like Edwin, who's always good for a question. It looks like Edwin's got a question for you. So I will mute myself and let Edwin ask his question.
Hi, Edwin.
Hi, Tina. How are you?
I'm good, thanks.
I was listening to your beautiful and lovely and opening and very vulnerable, synopsis of everything and an understanding and research. I applaud you and your son for being open about his HIV. That's amazing. I myself have, had scares where I've had it. And I know my mom was always like, just please take care of yourself. As a mom, it's very much your job and your sense of almost responsibility, even though it's not to take care of us, to make sure nothing comes our way. So I applaud you for that and your son. My mom is very much, especially having a gay son like me, who is sexually active. It's very hard. And I think that's amazing. My question is, when it comes to you and equals you, because I've been informed about that, and I was a naive college student who was like thinking HIV could be transferred through like kissing or anything like that. It's very much a unknown topic. How do you feel about schools teaching, wear condoms, abstinence? I went to private school in Henderson, so I went to Holy Name, and they taught us, I think it was 8th or 7th grade, about health science, but they never teach you more than just, please don't do it and take care of yourself and wrap it. How do you feel about them not teaching us about, if you do, this is what you should do. These are the preventive measures, or like, here's like a brochure or something where like, if it does happen, don't feel like you just committed a horrible sin, because that's what private schools do to kids like me. They make us feel like anything we do, it could be like this horrible sin and God's going to come down and basically just like end our lives. How do you feel about us as people who like are learning about STDs, but we don't know how to prevent them, or what happens like after you get one or anything like that?
Yeah. What a great point. Great question and great point you're making. It is hard for us. We wish we could have our own class in all the schools, because we also teach on abstinence, but we also teach about prevention. And I was just watching a webinar yesterday, and they were talking about the youth and not just talking about abstinence, but they really need the big picture. That way it gives them more power or feeling like they are the ones, feeling like they are the ones that are able to make the choice and be in control and the decisions that they want to make. We do make efforts to reach students. It's not, and unfortunately, it's not a lot in the actual school systems, whether it be private or public. But say, for an example, Boys and Girls Club, we would then go there and try to capture that youth and educate and meet them where they are if we're not able to really push our message in the school system. But yeah, it's much needed.
Thank you, Edwin. Do we have anybody else with any questions for Tina at this point? I can certainly echo the need for sex education in the classroom. I taught middle school and high school before I came to the college, and so obviously we certainly need that sex education portion taught in both private and public schools. Edwin, did you have a second question, or do you still have your hand raised?
No, I have a second question because I wait for people to ask questions, and then if not, then I want to ask another one.
Okay, well, I do have Amanda is going to ask a question too, but since you're already unmuted, why don't you go ahead and ask your second question, and then we'll move on to Amanda.
No, I want to hear Amanda's first, then I'll go.
What do you guys want to do? Fine with me.
All right, thank you. I guess the question that I had was how are, I don't know how you promote the services that are provided there at Matthew 25, but just as a person who lives in the community, works here at the college, like I don't have any access to brochures or things like that. Where can I get those?
Sure. We try to promote as much as we can. We're out. We want to talk to the community as much as possible. You can go to our website, matthew25.org. I can get some brochures out to the college. We can get those to you, Adam, possibly.
Definitely, yes, we can get those. Dr. Phillips is going to be on later talking about the services that we have for our students, and Angie Watson is the person who also helps with all the student services. So we can definitely have a place where those brochures could be housed in the Start Center.
Yeah, I think we've got some posters that we brought out and that are up. I don't know exactly where, but they're posters about testing, prevention, PrEP, and treatment, things like that. And
just to touch on Amanda's question, as a member of the LGBT community, I can certainly tell you that, area, certain bars and restaurants and things, and I know that you definitely target certain frequented places by the community. So while the community as a whole may not have quite as much information about Matthew 25 and the services they offer, I can certainly tell you that the LGBTQ community in our area certainly does have a great knowledge of what Matthew 25 offers and does for them. Because you guys have been around for a while.
Adam, before we go on, there was a couple of comments in the chat. Fundraising activities like Dining Out for Life, and also advertisement on Facebook, Twitter, and Instagram.
Right. So that's how we're getting extra funds for Matthew 25, because that's one of the things we wanted to talk about today as well, is what we can do in the future to work together to help raise some of those funds. And I've got some ideas also when I get to my points. But thank you for that. Edwin, did you want to ask your next question?
Yes, and then I have to sadly and unfortunately leave the conference just because I am working in LA right now. So I just wanted to tune in for a few of it. But so I'm on the West Coast. But anyways, I also want to know, just to clarify, I know that sometimes people can relate PrEP to, let's say, like birth control for women, because it kind of prevents, like obviously us as males that were born males and have everything, we can't get pregnant. So, it's different versus like, a woman doing birth control and preventing pregnancy. So for us, it's like, I feel like PrEP is to prevent it, but you can clarify this, but it is not 100% effective, correct?
It's well over 90% effective.
Okay, that's what I thought.
Yeah. Even birth control is not 100%.
Right, that's what I was clarifying. It's like the same exactly. Like, it's like, take it, but don't
you
assume
also
that you can do
everything. You also want to use condoms.
Correct.
To prevent STIs, and then you have to use condoms along with PrEP, and we encourage folks to do that. All of our PrEP patients to use condoms.
I would say wear a mask, but at that point, I don't think it matters anymore. Well, thank you, Tina. I just wanted to ask those questions. I
Thank you,
appreciate it.
Edward. Have
I'm
fun
gonna
in
have to
LA.
step back. Oh, thank you,
Okay,
guys. I'll see you guys
also,
later. Okay.
all right, thank you. Also, we have some questions in the chat, and we also have some other hands raised.
Okay, the question in the chat looks like it's already been answered, but we'll go ahead and point out that they were asking about the HIV testing and it being free of charge. It is free of charge. Is that for anyone with or without insurance, or is that only for someone without insurance? Well, I guess insurance would cover the cost.
Oh, and if you come to Matthew 25, our tests are free. We don't even ask you if you have insurance.
Gotcha. All right, and then I believe, Caitlin, you had your hand raised next. Is that right?
Yes. So my question is about PrEP. The commercials say that it's not been tested in those assigned female at birth. So does that mean that that population can't use PrEP, or is it that they're still prescribed PrEP, but we're kind of watching like a clinical trial to make sure it's okay? How does that work?
There are 2 different medications now, and one of the medications is strictly just for males. And I think they are doing more research for just if you're assigned a woman at birth. And I honestly, that's a very detailed question, and I apologize if I can't answer that. That's a little in-depth for my knowledge on the PrEP, so I apologize.
That's
I do know
okay.
that there's still some studies out there on that.
Okay, yeah, I was just curious because, you know, I wanted to know if there is an option for women or if that was coming down the pike.
There is. I mean, women can take PrEP, but there's one medication that's strictly for males.
Okay.
Yeah.
Okay, thank you.
You're welcome.
Lots of great questions, everybody. Keep those coming. All right. I don't see any other hands raised at the moment, unless I'm missing somebody.
Okay, so sorry, I just need to help answer that PrEP question.
Oh, is this Leon?
Yes.
Yeah, Leon's been answering your questions for you in the chat.
Yeah, I was trying, but I'm a little bit behind. So Truvada can work for women as well, but the new one, which is Discovery, is the one that is only for those assigned male at birth. So there is PrEP for women as well. And it's called Truvada.
Yeah.
Okay, thank you.
You're welcome.
Awesome. Any other questions? I think that's a testament to your presentation, Tina. You really answered a lot of our questions as you presented your information. So thank you so much for that. We appreciate it. Any other questions for Tina before we?
Angie, I'm sorry, there's another question. Angie Watson has her hands up.
Go for it, Angie. Thank you.
Hi there. Not really a question, just looking forward to having Matthew 25 back on campus late September for our Healthy on the Hill event.
Oh, wonderful.
So, you know, we've had y'all in the past, and we can get your information and certainly store that in the HCC Care Center. But, you know, looking forward to having everybody, you know, as far as community services back on campus for our students to access, and in a confidential place where we can have you, as far as, you know, if you do the free testing, like to make that offer to students as well. So thank you so much for today.
Thank you, Angie. We look forward to September.
Awesome. Any other hands? Anybody else? Go for it, Dr. Warren.
I'm just dropping a picture in the chat there, and I was just really impressed with this quote, one of my favorite quotes that's on the wall at Matthew 25. So just thanks for your presentation, and enjoyed the partnership with you guys.
Thank you very much. Absolutely.
Angie, I see you still had your hand up. Do you have any more questions?
No, sorry.
That is fine. That is fine. So now we're going to move to HCC Student Services and Resources. Here, Dr. Phillips, you're up.
Well, first, just thank you, Dr. Chappelle and Adam, for organizing it, and Tina, I think your presentation was great. You know, just communicating. I think communication is huge on just the different services Matthew 25 provides, and just education about HIV and STIs, and just really creating a culture of awareness in Henderson County and our surrounding areas. In my role of Dean of Enrollment Management and Registrar, I get to work with student affairs staff every day. And I think our goal on campus is to ensure that we're providing an open and caring environment for all of our students here at HCC. So a lot of our work within different areas focuses on equity and access. So I think your presentation, was great. It's giving a lot of, I think, opportunity and space for staff on campus to reflect on how do we do better with partnerships? How are we communicating these services to our students? I know in the past, we've had you on campus, so I'll say from my perspective, Matthew 25 is truly a valued partner in our community, but a valued partner in regards to our students and how we serve them. Multiple staff members and faculty members at various points in their professional experience have gone through Safe Zone training. I know, just speaking for myself, I've gone through that training, and it has really informed my work with students. So I hope, Adam, that we can figure out a way post-pandemic to look at providing that training and that space and that opportunity in the future for our students, staff, and faculty. I just know that was a truly meaningful experience for me to go through that training. I'll put a shameless plug out there for the Care Center and our work that Angie and her staff have done with that. We're excited to provide some basic assistance to our students in the areas of food insecurity, as well as some just basic needs insecurity. We do have an emergency fund at the college that we work with our foundation on. And that emergency fund allows students to get access to basic housing needs that may emerge, or transportation challenges. We know small hiccups in life our students face occasionally. We've helped with healthcare bills before as well. I think the final thing that I just want to leave this group with is just we have a lot of great faculty and staff on campus, but I think we're more successful when we look into the community and say, how do we partner? So again, I just appreciate the work of Matthew 25 for a rural community. We're blessed to have that service and that provider. So I've worked with Cindy on multiple projects, especially with the area of homelessness. So you guys are just a true valued partner, and just love to explore how we can continue that partnership and support our students.
Thank you, Dr. Phillips. I'm sorry, we say that. Anybody have any questions for Dr. Phillips?
Just in case anyone's listening, I know you mentioned the Student Emergency Fund. Can you tell us how students have access to that, or how can they access those emergency funds if they need those?
Definitely. So the Student Emergency Fund, number one, it is funded through our foundation. So our students access it often by a faculty referral. So we communicate to faculty and staff at the beginning of the year that, it's a pretty straightforward thing. We're trying to eliminate as many barriers. So just getting that student's information to financial aid, and then we run it through a very, very quick, brief committee and get that aid out to the students. Just with COVID, we've looked at some other aid that we can provide students. We do now have a pot of money that can provide counseling services to students. Henderson does not have an on-site counselor, so we make referrals to community partners, and we know if that comes a cost. So we now have an emergency fund just devoted to counseling services. So, another avenue to think about and promote with our students.
That's awesome. Thank you. Dr. Warren has a question.
I was just going to add that on the Student Emergency Fund, new this year is that those funds that were raised have now been endowed. So instead of those monies just coming in and going right out, any monies that are coming in now are invested in the endowment, and we're using earnings. So that will ensure that we have a continuing stream for the future.
Awesome. Thank you. Any other questions or comments for Dr. Phillips? All right. Thank you, Dr. Phillips. We appreciate you explaining those programs and services that we have here at the college.
Thank you, Adam.
You're welcome.
All right, next item on the agenda is Adam Blair.
All right, I'm up next, so let me share my screen here. All right, from the beginning. Okay, so my position here is I'm actually the teacher education coordinator, and so I work for Henderson Community College and for Murray State University, but I'm also one of the sponsors of the Pride Club. And Mark Chandler is one of our other sponsors, and he's the medical assisting program coordinator. So he and I have been working on this group for the last couple of years, but I can certainly tell you that it's been around for a long time. This particular group has changed sponsorship over the years, but 10, 15, 20 years, this group has been around in some form or another. But the mission has always been the same, and our mission is simply to create a safe space for anyone on campus, students from all walks of life, to be able to come together, have a place to be heard, and also to give back to the community. So that's a big portion of what we're doing with this particular group, is that community component, that community service component. And so that's why we are so excited to work together with Matthew 25 and be able to continue that partnership in the future and work with supporting our community. So just some general information about the Pride Club I wanted to give you guys. We do have monthly meetings, and they're open to everyone. Before COVID, we had refreshments, we'd have meals. Obviously, whenever you want to get a group of people in the door, it's always helpful to feed them. So we would typically have those types of meetings. Because of COVID, I've done more virtual meetings and a lot of one-on-one. I've had students from different classes who will contact me asking about what the club does and what we're able to do, and so I'll give them information and speak directly with them. As I mentioned before, community outreach is a huge part of our organization's drive and mission. We partner with local groups and organizations. We partnered with Matthew 25 last year during our drag show to supplement the food drive and to help the food pantry. We also have looked into helping with hygiene kits and just donations to our local men's and women's shelters. So as an LGBTQ person, we quickly realized that we have a sense of community, and we know that we don't always feel like everyone is supportive of us. So we certainly want to go above and beyond to be supportive of our own community and to assist others. So that's where that community outreach portion comes in. We do also have a Facebook page for the Pride Club. It is a private page, so not everyone can actually get to it. You do have to be approved to be admitted to that group, but that is an up and functioning page. So if you're out there and you want to search for that, by all means, send a request through and I'll be glad to add you to that. As far as the drag show that I mentioned, or activities that we like to do, Dr. Warren actually had mentioned that in his previous placement at Hopkinsville, they had done something similar. They had talked about something similar. So one of my prior co-sponsors was David Belt, and he's no longer with the college, but on this particular slide, you'll see Mr. Belt on the left-hand side, one of our students on the right-hand side. And so last year, in the spring, we put on a drag show. And for those of you that aren't familiar, a drag show is typically when men dress up as women or women dress up as men. But as you'll know now, everything seems a lot more fluid. So you'll have people just dressing up in various attire and showing off their different talents. So ours was kind of a variety show. It was a talent show. We had students who shared their musical talents. We had students who sang. We had students in bands and things like that. We also had information booths, and we had volunteers. We had HIV testing. So again, with Matthew 25, we partnered up with them for this event, and they offered that free HIV testing that Tina mentioned to anyone that participated at or who came to see the show or participated in it. It was the first of its kind, so we did get a little bit of flack from some community people, but all in all, it went really well. We did have one lone protester who was very polite, very respectful, and we did have, of course, security on campus that evening for the event. But we had over 150 people. It was very much a success. It happened right before COVID, so it was kind of a nice event that we got to have before COVID, and so that's one of the things I remember about the Pride group from last year, is just how big of an event that particularly was. It did take several months to put on, and there were a lot of people that were involved, and we had quite a few faculty and staff members that participated, not necessarily in the show itself, but were in the audience and helped with volunteering. So I certainly want to thank them for that. One of the upcoming events that we have in mind and that we've talked about, and I certainly can't take all the credit for this because we've talked about this for a couple of years, but as many of you are aware, in the area, we do have the Highway 60 yard sale. And so all up and down Highway 60, we'll have people that are having the yard sale on that particular date or that weekend. And so what we would like to do is consider having a space here on campus where we can rent tables to the public and have a specific number of spaces and have people who aren't close to Highway 60 have the opportunity to be able to participate in that yard sale as well. So I thought that with all this prime real estate with our parking lots, we might have a good opportunity to do some fundraising there and to work again with Matthew 25 and our local men's and women's shelters in order to raise some funds and just kind of work together as a community and make ourselves stronger in the long run. So that's one of the activities that we have in mind. We've got lots of other things that we've kicked around. Ultimately, we try to do something that's always a partnership of some sort with our local organizations. We also want to do something that gives back to our community. So with this yard sale, we could use the proceeds, but we're also helping people who don't have access to this particular yard sale have a way to sell things and make some money. So it certainly could be beneficial to everyone involved. That's kind of the nuts and bolts of the Pride Club itself. One of the things that I wanted to leave you with was some things that you could consider in the classroom. I know we've got a lot of faculty members on here, and even if you're not a faculty member, this can certainly be used inside and outside of the classroom. But just some general tidbits to keep in mind when you're teaching in today's climate. Obviously, you want to be inviting and welcoming to your students. That doesn't mean you have to put on a show and all this fanfare, but just, have kind of an open door policy. Allow your students to come in and speak with you. Just kind of be welcoming. Allow them to step foot into your classroom and have the dignity and respect that everyone else has. So I can certainly tell you that based on my own experience and certainly from, what I've seen in our community, the last several decades, we've had a lot of, gay and lesbian students on our campus. So that's certainly not been an issue for any of us. We don't have a problem with that. That's not something that we really focus on or concern ourselves with because it's part of our everyday life now. But what you'll notice is that we do obviously have a lot more trans students and students that are maybe more gender fluid and students who maybe haven't even figured out their sexuality just yet. So as you know, we're a community college. We service everyone in our community. And so the main thing is that we want our college to represent and to look like the students that it represents. So that's hopefully why we're getting all of these additional students involved in what we're doing. But in the classroom, you want to make sure that you allow everyone to speak and to be able to voice their concerns. Now, obviously, we have a lot of content to cover in our classes, so this is not something that you're just going to take the entire class time to talk about their problems or their issues, but obviously, there are certain times and certain classes that lend themselves to this. And so when there is a time that students can speak and voice their concerns, allow them to do so. In that same point, we don't necessarily want to shy away from sensitive topics. And again, as the college faculty, we typically are encouraging students to kind of step outside their box, to try new things, to push themselves, to work harder, all of the above. So when it comes to sensitive topics or things that maybe a student wants to talk about, give them the opportunity to be able to have that conversation. Again, it doesn't have to happen in the middle of your class, but it doesn't necessarily mean they should be shut down either. So giving them the opportunity to speak and to say how they feel. Also, you'll notice, I'm sure, that in some of your emails, at the very end, when someone signs their name, you'll notice they've started putting pronouns after their name. So one of the things we've always done at the beginning of a class is you'll ask the students, hey, Dr. Chappelle, how do you want to be referred to? What name would you like me to call you? So, if she's going to tell me, hey, my name's Michelle, but, I prefer to, my pronouns are he, him, his, that could certainly be something you jot down in your records, and that way you keep track and know how to speak to your students. So none of this is really recreating the wheel here. And I think Dr. Warren touched on this earlier. We're a very welcoming campus. We certainly don't try to turn anyone away. We welcome everyone with open arms. But the thing is that we also want to, again, be a representation of all the students that we have out there. So working with the Office of Diversity, Equity, and Inclusion, we are allowing these students to have this safe space and to be able to, come together on campus in the classroom, just share who you are with the world and not have to diminish your light in any way at all. So those are some things that you can essentially do in the classroom. My co-sponsor, Mark Chandler, has some things that he wants to remind you of and some closing remarks, but I wanted to stop here and see if anyone has any questions about either the information that I've shared with you or the information that you've heard earlier in the presentation. So we'll go ahead and do more question and comment time if anybody has any, and then we'll let Mr. Chandler take over and do closing remarks for us. All right, I don't see any hands at the moment, so if you have a question or concern, feel free to throw it out there to the group. Otherwise, we'll let Mark take over and remind you of some things we want to do.
Thank you, Adam.
Perfect.
I do want to remind everyone, if you do have any questions about the Pride Club, see any of us, the speakers today, talk to Adam, me, anybody, we'll be glad to get you in the right direction, let you know about when the meetings are, and get you started. Just going to close out with thanking people today. I want to thank, of course, everyone for joining the conference today. I feel like there was really a lot of good information that was shared today. I want to give a special thank you to our keynote speaker, Ms. Tina Reed, and to Matthew 25 for this very informative session today. Also want to thank our president of HCC, Dr. Jason Warren, and Dr. Chad Phillips with the Office of Student Services and Resources for participating and speaking to us today. And then finally, I really want to give a big thank you to Dr. Michelle Chappelle from the Office of Diversity, Equity, and Inclusion, and Adam Blair with the Henderson Community College Pride Club for organizing this event today. It did undergo quite a bit of things, so I want to thank them. I ask that you please remember to complete the survey that's in the chat so that we can continue to bring you events like this and to get your feedback on it. And also be sure to fill out for the door prize entry for a chance to win the $25 gift cards. Be sure to enter your email address on that because that is how we will be contacting you if you've won the gift cards. So again, appreciate everybody's attendance today. Thank you for attending. Have a great rest of Friday and a great weekend.
Thank you, everyone, for attending. Thank you, Mark. Thank you, Adam. Thank you, speaker. Any last words from Dr. Warren?
Not at all. I'm just glad to be a part of these events and got some great people on campus and appreciate you supporting our students and love our partners in the community and we'll keep that going.
One last thing I'd like to throw out there to all of you is that you don't know the answer to a question you don't ask. And I think that sometimes in our community and our climate that we have today in our society, we're afraid to ask questions. If you're coming from a place of love and a place of respect, you can ask questions of people. So for instance, there are probably many of you on the call who are thinking, what is LGBTQIA+? What do these letters even stand for? It's okay to Google it. I have to Google it. They're still adding to it. So the whole point of it is just to notice that basically we're welcoming to everybody. Doesn't matter how you refer to yourself. If you are a person and you are on our campus, we love you and we want to break bread with you and we want to work together to make our community better. So essentially, again, I want to leave you with ask questions, be respectful. If you're coming from a place of love, no one is really going to be offended by the questions that you ask.
I like that, Adam. That was a good point. I really appreciate you saying that.
Don't forget to fill out for the gift cards. I've got 4 $25 Visa gift cards burning a hole in my pocket.
If nobody wants it, I get them.
3 here.
All right, you guys. Thank you so much, everyone. Have a great weekend.
Goodbye.
I think you can stop recording, Michelle. I don't know how. Oh, I did it.